The Nevada Minority Health and Equity Coalition Public Policy Workgroup presents Advocacy and Policy Change. Thank you for joining us for another in our advocacy series. I'm Tom McCoy, Executive Director of State Government Affairs for the Nevada Chronic Care Collaborative and co-chair of the NMHEC Public Policy Workgroup. Joining me is Rebeka Acosta from Act for Kids. Rebeka, as I understand it, you are a certified patient advocate and a volunteer advocate. Could you make sense out of those two?
Sure. Yes. Thank you so much for having me. It's my pleasure to be with you this morning. I am a board certified patient advocate, which is a national certification. And I use my license to work with kids and families in Nevada, navigating the system and just making sure that they have everything that they need for their healthcare. As far as Act for Kids Nevada, I am a proud volunteer. I'm also a parent of two teenagers with lifelong illness. And so I volunteer my experience, my expertise with the board at Act for Kids just to help teach families how to share their stories, to keep up with all of the latest changes at the state and county levels, just helping where I can.
Rebeka, what's the mission of Act for Kids?
Act for Kids, we are parents, advocates, healthcare professionals, and we really formed in a grassroots way. I actually met the president a couple years ago on Instagram. So the algorithms worked for some good there. We really exist to elevate the voices of the patients and families in pediatric healthcare. We believe for a long time they have been largely left out. Not necessarily by design, but just by how the system is working right now. So we really want to bring patients and parents and caregivers to every table where healthcare decisions are being made for our kids.
Is there a particular policy that you're looking at for 2025?
Oh, this is where I get a little excited and I want to keep up to date on every single bill draft and proposal, but that's really difficult. So we at Act for Kids, like I said, we represent the patient and family voice. So we are not necessarily proposing specific legislation, but we are working and collaborating with all the other youth-focused organizations across Nevada that are proposing legislation. So a couple off the top of my head, I know there's a lot of excellent work going around children's mental and behavioral health. We fully support that and have partnered with Children's Advocacy Alliance to get the word out there with all of our families and connections. Anything to do with provider recruitment and retention is huge in our state, and we have signed on to support those. It's just really any legislation that moves the bar forward to have comprehensive healthcare for our kids in the state. We are going to reach out to those organizations sponsoring the legislation or proposing the legislation and do what we can to get the word out.
During the interim session, in which opportunities arise for organizations such as Act for Kids to come before legislators and talk about issues and potential issues that could result in legislation, I recall that you and others from Act for Kids were talking about cancer care for younger people in Nevada. You want to share some of
Yeah,
that with us?
one of our great community partners that we have been so honored to connect with is Cure for the Kids Cancer Foundation here in Las Vegas. They invited us to tour their facility. They shared their model and how they've created their comprehensive center for kids with cancer. And that's really we would love to have that copy pasted, obviously, for all children, for all healthcare needs. And so after meeting with them and just really learning how they had to band their community together to get this done, we launched a community support campaign where we wrote a letter to the Joint Interim HHS committee. And we had over 20, I believe the file number was 24, 25 youth-focused organizations across Nevada that signed on to that campaign. So we were able to present this letter with our public comments and the signatures and organization information for all of those that supported us, really to show that we are doing the work of bringing the community together. We are presenting unified voice for the patients and families, and that the healthcare organizations and community are behind us as well. So it was very thrilling to be able to do that. And I think that was one of the big acts that really put us on the map with the legislative committee.
Well, viewers watching this might be interested in how you prepared for that interim committee. Was there anything special? And you, as a certified advocate, certainly have some training in terms of moving forward issues related to a patient. So give
Yeah.
us a little bit of insight as to what you did.
It's a little bit different on the legislative side. I do have a little bit of experience there, learning the hard way. I've done some advocacy in DC at the federal level, but every state works a little bit different. And I'm not a Nevada native. So in the last 7 years, I've learned trial and error how our state government works. But we definitely reached out to the committee via email to let them know who we were, what we were going to be presenting and asking for. And then we also reached out to their research staff in the Legislative Council Bureau. They were amazing resources to help explain the priorities of each of the members on the committee, to really explain to us, the chairs, what they had put out, what they really were looking for. They wanted unified proposals. They wanted to see the community break down silos and really present a unified front. So that helped us prepare a tremendous amount. Just having that background information and understanding our legislators and what they were looking for, we could really tailor our requests and our comments to their needs.
So going forward, in terms of some of the potential legislation that you might be helping with, what recommendations would you give to someone who doesn't have a lot of experience with the legislature or with advocacy? What recommendation ideas would you give for kind of the first step in terms of meeting with their legislator or other legislators?
Yeah, that's a great question. I would always tell everyone, and I work predominantly with kids and their families. So I say everyone is an advocate. But whether you're 5 years old, 50 years old, you can do it. The legislators and their awesome staff are regular people. They want to hear from us, right? We elected them, and they want to be able to pass legislation that serves the people of Nevada and our needs. So first and foremost, put that nervousness and that worry aside. They are people that go to work every day and want to do the best for our state. And then just reach out, find your people. Find Act for Kids was formed almost on accident, but with great passion. Like, we all kind of found each other in different ways and decided, well, hey, we're 8 people here with different experience, with our own families, within our professional work, but we're the only ones talking about it. Let's come together and figure out a plan. Relationship building is number one in advocacy. So reach out, send an email to your elected representative, introduce yourself, introduce your family, and tell them what you're worried about, right? Ask what they're doing in that area. Just get the ball rolling and start asking questions and start talking. It helps.
Now, is your organization, Act for Kids, basically an informal group of volunteers, but do you get together in person, or is this done primarily virtually?
Yes, we do. We have had several in-person meetings. We do have our board meetings once a month, and they're half and half in person and on Zoom. But coming up, we will have our first in-person big event on October 8th, as a listening session on pediatric healthcare, where we've invited government affairs, legislators, the local media, hospital systems providers, and families to just hear stories from patients and families and caregivers about what it's like to access healthcare for kids in our state. So we're really excited about that. We think that's really going to launch it, just the awareness for the general public.
Rebeka, how do you market something like that in case somebody watching this says, hey, I'd like to do something like that, but doesn't know where to start?
Again, it goes back to relationship building. We have formed great relationships with Las Vegas Heals, which is very active in the healthcare community on the adult medicine side, Children's Advocacy Alliance, all of our community partners that serve youth and children in our state. We reached out to them and said, hey, we want to do this. Will you share the word in your newsletters, on your social media, in your blog post? And they did. They responded. So we are almost at capacity for the space that we have, which is absolutely amazing. But again, building those relationships from day one, and finding the people that are doing similar work is key.
Well, this has been great information, and we appreciate everything that you're doing, and it'll be interesting to see what develops in 2025 at the Nevada State Legislature.
We'll be watching.
Thanks, Rebeka.
Thank you,
There
Tom.
are 5 videos in this series. We encourage you to hear the perspectives of other public policy workgroup members on another advocacy and policy change. Thank you.